Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and thank you for joining us for Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, and the new location in Pennsville. I'm Joe Chapana. We are live for the next half hour. Our topic tonight is general sports injuries. So we'll cover the gamut, the shoulders, the knees, the back, whatever you want to talk about is fine with us. Our toll-free number is 1-888-634-7488. You can call that number with a question about something you may be experiencing. We also have a local number. It's 856-767-8884. If you prefer, you may email your questions to us. It is WPSJTV@AOL.com. At the end of the program, we're going to give you numbers for Cross Keys Physical Therapy, and they're offering free evaluations for the next 2 weeks. We'll tell you more about that at the end of the program. Right now, though, I want to introduce our guest tonight. He'll be answering your questions. We have Dr. Paul Marchetto, who is the Director of Sports Medicine and an orthopedic surgeon with Drexel Orthopedics, and also the team orthopedic surgeon for the Eagles and the Flyers. And next to him is Dave Anselmo, who is a physical therapist and owner of Cross Keys Physical Therapy. Welcome to the program, gentlemen.
Thanks, Joe.
And we'll start with you, Dave. Spring just around the corner. In fact, we were talking about this before. Pitchers and catchers are already there, right?
That's right.
Okay. And people wanting to get started in activities. What suggestions would you give to someone who is starting to exercise after months of inactivity?
I highly recommend anyone that has not participated in any type of exercise program for 6 months or longer to obviously go see their family physician just to get a medical clearance for any underlying factors that might limit their ability to be able to participate in an exercise program in a safe manner. Just for simple cases of cardiac problems or orthopedic problems, some of which we'll be talking about tonight.
Okay, and talk about soreness, Dr. Marchetto. When you first start out, there's going to be soreness. How do you know if it's something you should stop from doing or something that's just normal wear and tear?
Well, if anyone's started an exercise routine without preparing, they're going to feel sore. Soreness usually is something that peaks after the first day or so of activity and gradually diminishes. It's that persistent, sharp pain that would concern one and that needs something to be looked at.
Okay, now if someone has done something too soon, what can they do to themselves at that time? How do you get rid of the soreness?
Well, first off, of course, is ice after the activity. That's number one. Number two is to take some kind of an anti-inflammatory, over-the-counter drugs now like Aleve or Motrin, ibuprofen. Those are all satisfactory, provided they're taken according to the prescription.
Okay, and we got baseball, softball just getting underway, and with that, a lot of shoulder problems, unfortunately. What kinds of problems do you see in baseball and softball players?
Well, starting up now, Joe, the big thing is we've got pitchers already throwing, and so we'll see a lot of throwing complaints. The kids are just still throwing indoors, starting to warm up. They're getting outside now, and with that, they get increasing shoulder pain with the release of the ball. Subsequently, they get a little rotator cuff tendonitis and may get some elbow complaints. And with that, we try and sort out those problems and start them on a good stretching routine, and most importantly, re-establish good rotator cuff strength. Dave can talk about some of those exercises that we do for rotator cuff exercises.
Well, there's a lot of, once again, I'm a big believer in preseason conditioning, so hopefully that will help to prevent a lot of these injuries from occurring. But just baseball in general and softball, there's a lot of repetitive motion, a lot of stress on the shoulder joint. So we really believe in really stabilizing the shoulder and getting a really good dynamics and strengthening the muscles that surround the shoulder joint that work together, dynamically together, really so well that if any one of them goes out or injured, you really start to put the stress on the other. So it's real important that you get involved in a real good strengthening program for the rotator cuff muscles. And anyone that wants to get involved in any of that, they're welcome to call our office, and we'll actually send you it, or you can come in for an evaluation and we'll show it to you.
Yeah, they're offering free evaluations for the next 2 weeks at Cross Keys Physical Therapy. Their locations in Woodbury, Sicklerville, Washington Township, and Pennsville. At the end of the program, we'll give you the numbers to the individual centers to take advantage of that free evaluation offer. Right now, though, you can call us toll free. It's 1-888-634-7488. We'll be happy to talk to you about any sports injury you may be having as we talk general sports injuries tonight. Our first caller on the line is from Ben Salem. Bill, are you there?
Yeah.
Bill, welcome to Sports Doctor. What can we do for you tonight?
Hey, I got a question for you. I'm 40 years old, pretty active guy, play a lot of softball, pick up football games, and a lot of golf. Fell off a roof and shattered my heel and my ankle in about 9 places. Looking to get some advice for a doctor, that I'm not happy with the guy. I've been dealing with this since June of last year, and I'm now back in a cast. Nothing's getting fixed. Nothing's getting any better. I just feel like I'm being shuffled around from doctor to doctor.
All right, Bill, well, we've got the team orthopedic surgeon for the Eagles and the Flyers here, Dr. Paul Marchetto. Of course, without seeing his...
Well, Bill, that type of injury, heel crush that involves the ankle, is very debilitating, as you've figured out. And the one thing that one always asks is whether or not the ankle is fused and the heel bone is healed, solid, and if you've maintained some type of an arch. I'm sure that they've already talked to you about getting some kind of orthotics to help maintain the arch. But most of the heel pain and foot pain that comes after these incidents requires ankle fusion. So what you really need is an orthopedic surgeon that specializes in foot and ankle. And there are several numbers that we can give you. Have your number after the show, and we can call some numbers in for you.
What is meant by an ankle fusion?
You eliminate the motion in the ankle joint by fusing the 2 bones in the ankle that are destroyed because of arthritis. In Bill's case, that's typically the case. Falling from a height, it crushes the foot and ankle, and those joints no longer are that pristine, congruent surface that work like a ball bearing, and they're graded, they're flat instead of round, so every time you try and get the motion, it grinds and hurts. So
just the fact that I think he said he had 9 fractures, that's pretty significant in when it comes to that foot. Yeah, that's significant.
Okay, Bill, we're going to hook you up with numbers at the end of the program. Actually, everyone, free evaluation offer from Cross Keys Physical Therapy for the next 2 weeks. Right now, though, this number, toll-free, 1-888-634-7488 or 856-767-8884 as we talk general sports injuries tonight. Let's talk about the shoulder, Dr. Marchetto. It seems to be one of the more commonly injured parts of the body for athletes. Why is the shoulder so vulnerable?
Well, you think about, Joe, the motion of the shoulder. I have a model here I can demonstrate. Of all the joints in the body, the shoulder is the most unstable because of the ability to move it in so many degrees in its plane. The socket is very flat and the ball sits on the socket with no inherent stability. The stability is maintained by the rotator cuff, which are the 4 muscles that help rotate the shoulder in its socket. So because it's mainly stabilized by muscle and soft tissue, the overload is very easy. You're not depending on the bony stability of the joint. So when you throw the ball to home plate, the arm wants to follow the ball to home plate. The only reason it doesn't go to home plate is because the muscles around it are stabilizing it. If one of the big things in baseball, especially young athletes, they're playing on 3 teams, they're throwing or pitching for 3 different teams, they're pitching hundreds of pitches a week, and that's why the limits are been placed. You fatigue the rotator cuff, and subsequently the stability diminishes, the joint starts to separate, and you end up starting to tear tissue within the joint. With that, it requires aggressive rehabilitation to reestablish joint strength and stability. We've added arthroscopic procedures now that once required open cutting of the shoulder, instability, dislocations. We're always treated with open dissection, 4 inches across the front of the shoulder, taking it down Now we can go in with the arthroscope as we do with the knee, and instead of cutting the shoulder open, we go inside the joint with the camera, and we're able to sew within the joint without opening it. So patients now, instead of having that months and months of pain from the big cuts, we're able to do all the operations within the shoulder joint. The patient goes home the same day, rehab starts much sooner, pain is dramatically reduced, and the results are excellent. So
Okay.
we're very excited about that now.
They're telling me we have another caller from Delaware this time. I didn't get the caller's name. Is it Fran? It's Graham. Graham? Oh, it is Fran. Fran, I'm sorry. Are you there?
Yes, hello?
Hi. Thank you
Yes.
for watching. Thank you for the phone call. What can we do for you
Yes.
tonight?
I'm a 66-year-old female who I am actively been studying ballet for years, and I twisted my knee from my kneecap to my ankle, and I discovered I have a medial meniscus tear in my left knee. But I'm a little leery about surgery because of my age, and I would like to know if all medial meniscal tears have to be repaired surgically, or can they heal on their own? I'm able to function okay doing daily activities. I'm limping. My biggest problem is limping and some fatigue, but I am able to take a ballet class, and I'm able to function, but walking is difficult, and I'm afraid of the surgery because I don't know about the recovery and how I would do afterwards. And I know I've seen in the paper a lot of sports people have had this problem and have had surgery.
Okay, first of all, is surgery always necessary? And if it is, can she ballet afterwards?
Well, first, she's already spoken of the fact that although she thinks she's fine, she's limping, she has some soreness after activity. So with that, it's not normal. She's getting along with it, but in fact, she's having symptoms. There's probably some swelling, she's lost some of her function, and she's curtailing her activities. First thing that we do, and Dave can describe that, physical therapy is important to rebuild the structures around the knee, the quadricep and the hamstring muscles that help stabilize the knee, and many times symptoms are under control with that. If conservative treatment, meaning exercise, does not bring you back to the previous level of your activity, something that you wanted to do, then arthroscopic procedures are appropriate. They're not nearly as invasive as meniscal surgery was in the past. The fact remains that at 66, there is some degenerative change that has occurred within the knee joint that will not be repaired with arthroscopy. And many of my patients come in with unrealistic expectations that just because it's a meniscus tear, they feel like an athlete, they get their meniscus trimmed up and they're back to where they were before. But when we go in there, we take photographs, the knee has a degenerative process that has been started 15, 20 years ago, and it's reaching a point where it's also affecting the knee function, and this injury kind of pushed them down the hill. So it has to be evaluated, judged, but if you're not returning to your normal activities right now, it's something to think about.
Okay, thank you for the phone call, Fran, and good luck with that. I want to remind you, we're brought to you by Cross Keys Physical Therapy. They're located in Sicklerville, Woodbury, Pennsville, and Washington Township, and they're offering free evaluations for the next 2 weeks. At the end of the program, if you'd like to schedule an appointment, we'll give you the number to do so. In the meantime, you can reach us toll-free with your question. General sports injuries tonight, 1-888-634-7488. Our next caller from Norwood, Pennsylvania, Tom. Tom, welcome to Sports Doctor. Are you there?
Yeah, thank you. I'm calling about, I thought I hurt my rotator cuff, and I have a lot of motion, so I know it's not that, but what it is it feels like it's in my bicep. I'm getting a sharp pain when I'm picking something up, or like it feels like maybe tendonitis or something like that. Is there anything I could do for that?
A pain in the bicep.
Well, one of the things, Tom, is that shoulder pain will refer down to the mid-bicep area. So we'll get patients that feel, and they'll come in complaining of arm pain, when in fact it's pain from the shoulder that radiates down to the arm. That is very commonly rotator cuff pain. What we look for are loss of motion, loss of strength in certain ranges. If you're externally rotating against a firm object, you'll find that you don't have the power that you used to have. All those things are pointing more towards rotator cuff. And with a simple examination, as Dave can do in his therapy center, that can be sort it out and put you on the right exercise program.
You'd be an excellent patient. Take advantage of the free evaluation.
Yeah, and again, we'll give you the numbers for that at the end of the program. All you have to do is schedule an appointment, the free evaluation offer from Cross Keys Physical Therapy. We're going to take a break in just a minute, but before we do, why don't we grab another caller. John, are you there? John is from Gloucester. John, welcome to Sports Doctor.
Yeah, I'm right here.
Hi, go right ahead with your question.
Hey,
John?
Dr. Marchetto, I don't know if you remember me. I had a double rotator surgery back in 2002, 2003.
Double, that would be on.
That's both shoulders.
How are you doing, John?
Hey, how's it going, John?
I'm doing good. I had it on one shoulder, repaired once, and then got in a car accident and repaired it again.
Okay.
I don't know if you remember me or not, Dr. Marchetto.
Well, yeah, John, yeah. How's it? Are you still exercising, John?
Yes, I still do. I still have a little bit of less movement, but it's coming along. I know it's going to take a little bit of time to get fully recovered.
Yeah, yeah. You're going to need to keep doing those exercises, John.
John, thank you for watching, and good luck with that. Thank you for the phone call. It is Sports Doctor. We're brought to you by Cross Keys Physical Therapy, Sports Medicine Center, Sicklerville, Woodbury, Washington Township, Pennsville. We're talking general sports injuries tonight. If you got a question, toll free, 1-888-634-7488. More of Sports Doctor right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Okay, we're back at Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, and Pennsville, offering free evaluations for the next 2 weeks. At the end of the program, we'll give you numbers to schedule an appointment. Our guest tonight, we have Dr. Paul Marchetto, who is the Director of Sports Medicine and an orthopedic surgeon with Drexel Orthopedics, and also the team orthopedic surgeon for the Eagles and the Flyers. And also on our program tonight, Dave Anselmo, who's a physical therapist and owner of Cross Keys Physical Therapy. Our next caller on our toll-free number at 1-888-634-7488, calling us from Delaware, which is not too far away from the Pennsville location at Cross Keys Physical Therapy. Dave, are you there?
Yes, I am.
Hi, what can we do for you?
I have had surgery on my shoulder 3 times within 2.5 years. I'm trying to. The pain keeps coming back. I know the first time was rotary cupping, some tissue repair, then it was tissue, then probably 8 months after that it was tissue again. But it just keeps reoccurring. What can I do?
Rehab.
Yeah, it's real. Really, you need to get into a real good rehab program to make sure you get the dynamics of that shoulder. Sounds like you're having some ongoing problems, whether it might be a problem with one part of the rotator cuff, and then you might fix that, and then you go to another one. So you really need to get someone to really take a look at that and straighten you out and make sure you keep up with your exercises. You must maintain your flexibility as well as your strengthening. So I don't know what you're doing in your program, but you need to see somebody to sort it out for you. You'd be a great person to take advantage of their free evaluation. Our Pennsville office is right across the bridge for you. So take advantage of it. I think you'll be happy you did.
That's a really nice program you have, the free evaluation offer, because you really look at what the person's doing.
Right. Basically, we'll evaluate you and see what's happening with the dynamics of that joint and see if it is physical therapy that you need, and if it isn't, then we will obviously refer you out.
Okay, Dave, thank you for calling. I hope you take advantage of that offer. Again, we'll give you the numbers for Cross Keys Physical Therapy at the end of the program. Right now, toll-free, 1-888-634-7488. We want to talk to you about your general sports injury question. Our next caller from Turnersville, Gene, welcome to Sports Doctor.
Thank you. About December the 6th, I had a fall, and I fractured my ankle, and I had a cast for about 6 weeks. And finally, I wasn't getting nowhere with that. And I went to Dr. Bradley, and he looked at it, and he said, "My God, you're not getting anywhere with this here." So he recommended me to go to, excuse me, Sport Doctor. So I met Dave there, and I have to say, so many thanks. I have to praise what I've been through, because he put me back on my feet. Matter of fact, when I walked in there about 3 weeks ago, I was using a walker, and now I'm talking to you and I'm walking around. And I have to praise your staff, Dave and Dr. Bradley, for feeling the way I do now. Many thanks. That's the reason why I had a call.
Well, thank you, Gene. It was very nice of you. I think that just a compliment to our whole staff. I think that everyone works so well together.
You have to praise when you get something good like this. I like everybody to know that, and I really appreciate everything you've done.
Well, thank you very much.
Okay.
Thanks for the phone call.
Gene, that was very nice of you to call. Thanks so much. And we want to hear from you as well. Toll free 1-888-634-7488. General sports injuries. Let's move along to Philadelphia and talk to Al. Al, welcome to Sports Doctor. Al, you're on.
Hello.
Hi.
Hello.
Yes. Go right ahead with your question, Al.
Can you hear me?
We can hear you, yes.
Yes, I had an ankle. Wait a while. Ankle replacement. The full ankle.
Okay.
June was a whole year, and I'm still in pain. You know, as soon as I put pressure or start walking, or if I sit for a while, and I want to put pressure on it, it still hurts.
Is that normal for this type of procedure?
Yeah. It's not normal for that procedure, but ankle replacement is very difficult to recover from, especially depending on the injury that led to it, what your muscle ankle function was before the injury, and how much motion you were able to regain with the total ankle joint. Very difficult procedure to recover from. Some patients end up going on to ankle fusion, as I mentioned before, because the joint just is not satisfactory, especially to get back to full activity. You have to watch your weight, lose weight, make sure you're keeping up with the rehabilitation exercises. And
it's a good question. What kind of rehabilitation is he doing? Is he still there?
Al, are you there?
Is he gone?
Yes, I'm still here.
What kind of rehab have you been doing? Have you done any aquatic therapy?
Up and down like a gas pedal.
Have you been involved in any type of aquatic therapy program at all?
No.
No. That might be something you might want to look into, especially with something where you're having that much pain with compression. Walking, putting you in the water might be a good place to you to start to work on the dynamics of walking properly, because it's really hard for you to walk right now because you have so much pain. So maybe putting you in the water, taking advantage of that buoyancy might be an advantage. It's a suggestion. So you might be a good person to come in for that free evaluation as well, so we can give you a good idea whether we think it would be appropriate for that or not.
Yeah, and while you're there, Al, you can probably see the pool where that therapy is actually performed. We'll give you the numbers for Cross Keys Physical Therapy at the end of the program. Right now, you can reach us toll free with your question about general sports injuries. Toll free 1-888-634-7488. Chip is our next caller. Chip is calling us from Medford. Chip, welcome to Sports Doctor.
Hey guys, how you doing?
Good, how are you?
Good. I just got a quick question. It's about recurring bone spurs in my ankle. I'm a former college athlete, Division I basketball player, and I had surgery on my right ankle about 4 or 5 years ago, and I just want to know, doctor, is there any chance of those things reoccurring? I am still active, working out, playing ball at age 40. I just want to know if it's going to be an issue down the road, or are they reoccurring? Does these things happen all the time?
Yeah, the spurs in the ankle, especially basketball players, are prone to twisting the ankle, can cause increasing irritation over the front. And I don't know if you had the procedure done open or closed, but right now, arthroscopically, these can be trimmed off quite nicely with minimal trauma. And to answer your question, no, they can reoccur. It does take quite a long time to reoccur, but they can reoccur if your activity level has been maintained to a high level.
Chip, good luck. Thank you for the phone call. Sports Doctor tonight. We're talking general sports injuries, although it's rapidly turning into an ankle show. Don't you?
Yeah, I didn't bring the ankle model for some reason. One thing I didn't bring.
1-888-634-7488. Also locally 856-767-8884, or you can email your question to us at WPSJTV@AOL.com. Dr. Marchetto, what is a torn rotator cuff, and is it the same as a labrum tear?
As I mentioned before, the rotator cuff are the four muscles that attach to the humerus, which is the arm bone. The muscles rotate the arm in and out. That's a rotation. The labrum, if we were to look at the joint of a shoulder, the shoulder joint is deep inside, and around the bony socket, there's cartilage that deepens the cup. And that's a better model there. This model demonstrates that the socket's very flat, and the labrum is the tissue around that socket that deepens it almost 30% and helps add more stability to the ball in the socket joint.
Okay, now Dave, Cross Keys Physical Therapy is going to offer a preventative program for throwing athletes soon.
Right.
Can you explain that to us?
Basically what it is a program that we put together that we feel is very beneficial for those throwers that softball, tennis players, baseball players that help to prevent some of these injuries that we're seeing through the year. We think it's real important. We'll teach them how to properly warm up, how to stretch, and actually do the strengthening exercises and how to do it pre-season, post-season, and during the season. So we really want to give them, it's really basically a preventative program for these type of athletes.
And if someone's interested in this, they should call
Just call the office.
Okay, very good. We're going to give you the numbers for Cross Keys Physical Therapy Sports Medicine Center. Again, a number of locations throughout the area. Sicklerville, if you'd like to take advantage of that free evaluation offer or find out more about the Throwing Athletes Preventative Program, the number is 856-728-1900. In Woodbury, it is 856-853-0988. In Washington Township, it is 856-374-3707. And in Pennsville, 856-678-8000. I want to thank our guests tonight, Dr. Paul Marchetto, Director of Sports Medicine and an orthopedic surgeon with Drexel Orthopedics, locations in Marlton and Philadelphia, and he's also the team orthopedic surgeon with the Eagles and the Flyers. And Dave Anselmo as well, who is the owner and also physical therapist with Cross Keys Physical Therapy, and again, located in Sicklerville, Woodbury, Pennsville, and Washington Township. We'll be back 2 weeks from tonight with another edition of Sports Doctor. Until then, for Cross Keys Physical Therapy Sports Medicine Center, I'm Joe Chipana. Stay well.